analysis, but for me it's where magic happens. I don't know anything about it. So if you get just, I mean, tell me, when you're researching everyday kind of activity, how did you go about collecting information that you need for such social network analysis? And then how did you do the analysis? The other thing, it's basically just for it to be a bit clear in my mind. The other thing is a classical question. How do you imagine that you're going to carry this forward beyond research, if you're actually wanting to do that? Are you thinking about establishing relationships with NGOs or kind of organizations working on developing e-health initiatives?
So the first thing is how to go about even getting like social network questions. It was just like because since we looked at friendship and advice networks, so it just needed to include these 2 questions in the survey. So the survey had questions on their media usage, on their knowledge on health information, and all that. So questions were list 5 friends from your class. So there was a roster given. So it's a sociometric network. So within the class or within the school, list 5 people who you go to for advice, and list 5 people that you go who are your closest friends. So it was more of a roster selection, and that kind of limits. Even for analysis, you know, otherwise it would be just like it's a friend from college, or it's my neighbor, you know. So that's one way to do it for social network analysis. So there were like just questions like that, you know, who are your friends, who do you go to for advice? So these are 2 typical questions. And after which there are many different ways to analyze, to go about doing social network analysis. And I am honestly like learning how to do social network analysis. I'm not like a pro in that. And this ergum was an approach that I thought, hey, wait a minute, you know, it seems interesting and it looks like it could be used to answer my question. So that's why I kind of used that. So that's as far as, I guess, social network analysis is concerned. What I want to do, like, following this, definitely like try to publish the paper. But I think this does not apply only to health. You know, it does not apply only to ICTs in health. I basically do ICTs in education. You know, that's where my main interest is. And I do like primary school education and how laptops and mobile phones could help children learn better. If I were to apply this same approach to, in the case of education, it's the same, like, right? So like now I'm doing a project in Peru as well, and the pre-analysis would be, who are these children? And I also asked what questions there, right? Who do you go to for if you have trouble with the computer? These are questions asked to children. And again, there were list of classmates in their class that they could choose from, and who are your closest friends? Who do you go to for if you have trouble, and who do you do homework with? You know, so these are 3 very standard, very focused network questions. And I think following which, you know, we can just see, using the same rationale to see, okay, who do children get information from? Is it from their peers or of the same gender, peers from different gender? And is it peers who have more computer literacy, you know, who have more computer self-efficacy? These are variables that we tested. And so this kind of information would give researchers or practitioners an idea as to how to further tweak an intervention or a program to kind of target the right people, you know, to maximize the impact of whatever we are trying to get at. So it can be applied across about different fields or domains.
Thank you.
Yeah, I think that's what my next step would be like.
Thanks.
Further questions for Komathi?
Yes.
Have you thought about doing a longitudinal study to see how...
Oh yeah, I did mention in my further research that I would want to do a longitudinal
So in
study.
terms of the hypothesis, what did you see in terms of the behavior change or the network change itself?
No, I can't really see a change in behavior because it was a one-time study, but it would be really interesting to see how it changes, like an evolution of their networks based on their knowledge or based on their exposure to media. So that would definitely be something that I'll be interested in doing probably, if not in this project, and as I said, it was really data that was collected, but in my subsequent health education projects.
It'd be interesting to see how the network sort of mechanisms might be, you know, formed through different sort of factors over time. For example, does friendship continue to be a very important indicator for, you know, the information-seeking network, or versus, you know, your classmates or other types of like a network contacts?
Yeah, I will definitely look at that and try to compare the networks versus the variables and the measures over a period of time. Significant relationship there, but in terms of health knowledge, we found that the amount of health knowledge that a person has does not relate to whether or not they are sought for advice. Whereas the amount of media usage, right, that they have is significantly related to how much they are sought for advice. So the more media usage that they have, more significant. And here we also saw that gender was also significant, meaning that people tend to sought advice from people from the same gender. You know, so females go to females for advice, and likewise for the males. And there was no significant finding in terms of close friends. So they did not necessarily, teenagers don't necessarily go to their close friends for advice on sexual health matters. They go to their advice network circle for information. Overall, what we're trying to get here is, where we're trying to get at is that instead of looking at you know, this is an overarching ICT4H implementation that we want to do. We should rather, before designing an implementation, try to understand the users, try to understand the community. And this is one way to understand the community in terms of, you know, what is their media usage like, what is the information level like, and through understanding the mechanisms and understanding the community, you can better design ICT4H programs and initiatives that could cater to their needs, right? So here, gender was found to be a significant predictor of information exchange among teenagers, as I mentioned earlier. And within the social support theory, informational support, affiliative support, and emotional support, they were seen to be interconnected within this theory, and I'll just leave it like up here for you guys to just take a read rather than me reading it out. But in terms of affiliative concept, when you talk to friends of the same gender on sexuality matters, it brings out the dimensionality of social support concepts. You know, so again, trying to emphasize the point on like usually gender is something that's often overlooked in ICT4D conversations. So this we're trying to like highlight that aspect of it. So in a more practical implication, we could think about consider crafting a social network-based interventions to help improve health, knowledge, and prevention among teenagers, right? And multiple facets of their social network, not only the information that they receive, but how they gather and process this information. So it's about the knowledge sharing and information gathering. So understanding all these before even designing ICT4H implementations in developing countries.
You have 3 minutes.
So based on this understanding, again, like we can have a better have a better perspective of what are the mechanisms of information sharing and how this is influenced in the communities that we're looking at. Very quickly, for future research, we could definitely look at a more longitudinal study because this was a cross-sectional research. So perhaps seeing if changes in knowledge of health information or changes in media usage affect the way the networks change or composition of the network. So that would be something interesting to look at. One thing that's definitely a limitation of this study was that it was collected in 2007, and we were and it's more like a secondary data that we worked on now, and we were kind of limited with the kind of measures that we could look at, and that's about it actually. So it's just trying to, I guess, overall expand the thinking to, hey, wait a minute, let's pause here. Let's look at the community and try to understand who we are talking about and try to get a better understanding of who we are talking, how they digest and how they take in information before we even give the information. That's about it. Thank you.